Hey everyone, thank you so much for being with us. We have another episode this week, and I have with me Monica McKitterick, who is a nurse practitioner. She's an author and she is the founder of Impact Family Wellness. She's on a mission to help people ditch the sick care system and embrace a healthier, more balanced life with mind, body, and soul. Equal parts science and sass. Monica brings real talk, and we're going to have real talk and real conversations today with a holistic approach and a dash of humor to every conversation. So, Monica, welcome in.
Thank you. Man, I'll bring the sass. That's me. Oh,
Me
that's me. Just
too.
ask my husband. He'll tell you. I think he gets sick of my sass sometimes.
But that's okay. You just can't help it. You're you and the amazing you that you are. So, let's dive into today's topic. Today, we're going to be doing some real chit chats on debunking the health insurance system for you guys and also showing you how to be an advocate because that's the biggest thing of how to advocate for yourself as a woman in healthcare and make sure that you're getting the right help, the right information. So, Monica, tell me how you got started in doing direct primary care.
That's a great question. It was actually a Facebook ad. It was clickbait, my friend. It got me good. I was relocating from New Mexico to Texas, and I'd been a nurse practitioner for 10 years, and I was really trying to figure out what I wanted to do with my life. I really liked orthopedics because I could fix things, but my ultimate love was primary care because I was trained to take care of a whole person as a family nurse practitioner. And the problem is primary care in the insurance-based system is absolutely exhausting. I had to see 30 patients a day. I would treated them like cattle. And turns out I wasn't actually taking care of them at all. I was checking boxes, writing paperwork for insurance companies, and hoping that I would give my patients some sort of band-aid to fix their issue, only for them to come back a few months later not happy, right? And that turns out is not why I went into healthcare. I went into healthcare to have relationships with patients and actually take care of them and treat them like human beings. And so the Facebook ad came to me and said, primary care physician takes home $400,000 a year and is home in time for dinner. Well, that's clearly a lie. So I'm going to click on that. Let's see what this is about. And it was all about direct primary care. And I was like, wait, what is this model of healthcare that takes healthcare back to the patient provider relationship? This seems interesting. So I did a bunch of research and then I went to my husband who has an MBA and I said, husband, I'm going to open a practice where I can see less patients, take better care of them, have more control of my time, and make the same amount of money. Spoiler alert, I don't make $400,000 a year, but all of those things can be true. And my husband literally laughed in my face and he was like, Monica, that's not business. Like, that's not real life. You might be able to have like two of those things, maybe three, but there's no way you can have all four. And so that just like lit a fire. And I was like, fine, I'll prove you wrong. So I Googled how to write a business plan because AI was not a thing back then.
Right.
Did a whole bunch more research, went to a conference and was like, I'm going to do this. And so I said, Dear husband, I need $20,000 from our savings account, and I'm not going to get paid for 6 months at least. And even when I do, I'm not going to be making the six figures I am now. And he was like, okay, sure, let's do that. He was definitely skeptical, but we did. So I moved to Texas 3 weeks later. I launched my practice. I knew all of two people in all of Central Texas, and built it from nothing. And it's a service people want and they need. They just don't know it exists. And so my job is educating people and doing all the things, but it lets me do what I love, and that's create relationships and take care of human beings. So
I
here I
like
am.
I like it. Well, tell me the difference between like regular healthcare systems versus direct primary care.
Yeah, so most people don't know what direct primary care is, so you're not alone. That is now my ultimate goal in life is to make direct primary care the norm, not the exception.
Mm,
So
yeah.
every person that is listening to this, you have to go tell somebody else about this thing you're learning about today. So direct primary care is membership-based healthcare. So it's much like Netflix for your doctor, a gym membership for your doctor, affordable concierge. So it's typically under $100 a month and you get unlimited care from there. So there's no copay when you come in. There's no office visit fee. It includes telehealth visits. It includes the ability to text your provider directly, not a medical assistant, not a nurse, your provider. And they typically will respond. Our rule is within 2 hours, we have to respond to our patients.
Wow.
Our providers are limited to 400 patients, where your insurance-based practice typically has 2,500 to 3,000 patients. That's why they don't know your name. They have no idea who you are, right? Unless you're a complete pain in the butt, and then they might know your name, but that's the only reason. So we really decrease our patient panel size so that we can take better care of them. We just don't have all the middlemen. There's no receptionist at my office. There's an iPad where you check in, and then it sends your provider a text and they come get you themselves. So you don't have to tell 4 people why you're there. There's no insurance paperwork to fill out. It's all done before you get there. All of our appointments are 30 to 60 minutes, so we can actually talk about the things that actually matter, right? Sleep, stress, nutrition, body movement, the things that actually matter in your health, not what pill can I give you. Now, don't get me wrong, there's a time and a place for a pill, but we completely overuse it in this country. And I'm not here for that. So we're all about making things affordable and price transparent. Just like you don't go to Starbucks and order your coffee without knowing the cost of it, I shouldn't expect you to make healthcare decisions without knowing the cost. And so we have a contract with the lab to get labs at about a 90% discounted rate. So for the ladies, if you want your estrogen checked, you want your hormones checked, it's $27 at my office. Here's your order, go to the lab. When I get it back, I'll make you a video, actually, is what I do. I make a video of your labs, and then you can watch it 14 times. Then you can come in and we can figure it out. So it's really taking all the struggles out of healthcare. Like, you can get a same day appointment. You can schedule that appointment online. It When healthcare is hard, people don't do it, right? When it's hard to get your mammogram scheduled, you don't do it. When it's hard to see a doctor, you don't do it. When you don't know how much it's going to cost you to see a doctor, you don't do it. And so people just avoid healthcare and they wait until they're dying, and then they show up and want us to fix them. They've had symptoms for 14 years, but now they actually have chest pain. And so now they want us to fix them. And now we're doing surgery and sending them to a cath lab, where if we had talked about this 14 years ago and done some preventative tests, we wouldn't be here. And so it's really all about like actually taking care of people. Unfortunately, our system is very sick care based. You go to the doctor when you aren't feeling well. Well, what if we went to the doctor when we were feeling well and we kept it that way? Just saying, novel idea. So that's really what we do, is we just take care of people without the middleman. Now, there is a time and a place for insurance company, right? Like, they're
Okay.
not all
About to
bad,
ask that question.
right? So what I can't do is take out your appendix, right? There's a time and a place where you might need that to be done. And that's where health insurance does come into play. But for 80% of your healthcare needs, a primary care provider can prevent you from having the problem or fix it for you. And so unfortunately, also our primary care providers in this country have become referral mills, because the reimbursement on primary care from insurance companies is pennies, right? So if I see a patient as a primary care provider, I'm going to get paid $85. If I'm a cardiologist and I see the same patient with the same code, I'm going to get paid $220, right? And so especially these big health systems, they don't have primary care because they make money. They use primary care to refer to their specialists where they can make money. And so your primary care provider, who used to be able to be like, hey, your blood pressure is a little high, let's try this medicine, or let's try this lifestyle change, or let's try this or this or this. Instead, they're like, oh, your blood pressure's high, go see cardiology. And it makes for terrible healthcare, because now we have all these people. You've got your rheumatologist and your cardiologist and your primary and your dermatologist, and they don't actually sit in the same room and talk about you. And so it's all these notes going. I could talk about this forever. I diverge from the topic at hand. But yeah, so direct primary care, healthcare that doesn't suck. That's really what it is.
So there's 1,000 things going through my brain right now, and I'm still sitting with the fact of like, what the fuck am I paying insurance for?
Oh, that's a great question, right? Because your insurance company basically practices medicine without a license, because they get to tell me as a healthcare provider what I can order for you, right? I can order a lab test, right? So a great example is a vitamin D level. So a vitamin D is a hormone, not just a vitamin, that regulates so many things in the body. And most people are deficient because we don't have soil that is rich in nutrients anymore in this country, because we've completely
Mhm.
depleted it, right?
Right.
You can have the best diet in the world and get sun exposure every day and still have a low vitamin D level. Yet a vitamin D screen is not approved by any insurance company. And it's going to cost you $180 out of pocket to get that lab test on average. But I, as a primary care provider, think that's really important. But I can't order it because your insurance isn't going to cover it unless you want to pay $180 out of pocket. Most people are not just going to sign up for a $180 test. Well, at my office, it's $13 to get that test done. And I think it's important. So I include it in the cost of your membership because it's important. Like that should be a decision for you and I to make, not your insurance company. The number of times we have to fight insurance companies on a test, like
Yeah.
whether it's a CT scan or an MRI,
Mm-hmm.
people will have injuries and your insurance company will say, oh, sorry, you can't get the MRI done until you do PT for 6 weeks. It's like, well, what is PT doing if they don't know what the problem is? Right? Like, if we don't know your ACL is torn, then how is PT going to help? But if we know your ACL is torn, guess what? If you want to move side to side, PT can't fix that. And so it's just like so many things, especially from medications, like the prior authorizations required for medications is
Mm-hmm.
mind blowing to me. How I, as a healthcare provider, can say, yes, my patient needs this medication. The patient agrees they need the medication. And then the insurance company says, yeah, we don't cover that. But we'll cover this alternative that actually isn't even the same medication at all. But that's the one that we have the best rates with from the pharmaceutical company. So that's what we'll cover. But if you want it, you can pay out of pocket for it. Like, how is that okay? Drives me
So
crazy.
how do people get the drugs then if y'all, so I'm assuming, walk
Mhm.
me through how do we get the drugs?
Yeah, so we prescribe the medications, but the cost of the medications is on the patient. So if they have health insurance, we will jump through those prior authorization hoops. Um, but even if you do have health insurance, you can oftentimes pay cash for it less than what your insurance company will cover. And I will tell you that is a genius move on the side of that insurance company, right? So if I have a high deductible plan and I go get a medication, it's going to cost me $85 because that is the contracted rate through my insurance company. Or if I use a GoodRx coupon and now it's $50, I'm going to pay the 50 bucks. But what happens is you pay that $50 directly and it does not go towards your deductible. So the insurance company just got out of paying anything for that medication and you paid it. It's genius. Like, why would you not do that as the insurance company? They have zero incentive to negotiate a better rate. I mean, the fact that GoodRx can get a better rate than my insurance company that has millions and millions of people, like I mind blown. We do have some patients that are on branded medications that are expensive, and oftentimes we order them from Canada. So Canadian pharmacies, we are the only country that pays for research and development. So all medications that are developed are paid for by the US. So I'm sure there's some like maybe Sweden pays for something because there's a lot of companies that develop things in Sweden. But for the most part, this is why medications are so expensive here. So, for example, I have a patient who is on a blood thinner that is a branded medication, and it is approximately $600 a month here in the US for 30 days, a 30-day prescription. This is a life-saving medication for this patient. Like he has a heart condition, like he needs to be on it. He's on Medicare. Guess what? Medicare doesn't cover this medication. So he either has to pay this money out of pocket or he dies, basically. So I get the exact same medication for him, same bottle, same label, everything, a 90-day supply. So 3 times as much, and it's $110 delivered to his front door. Right? But he would never know that if I didn't do that research. Like I did the work because I know what I'm looking for, right?
Yeah.
Just like your plumber doesn't expect you to go to Home Depot and find the parts to fix your toilet. We shouldn't expect this of people trying to navigate this really broken healthcare system. You shouldn't have to know these things. And so that's what we do for our patients is we are really advocates for them to get them the care they need without breaking the bank. Yeah.
I, well, number one, I'm infuriated because
Mm-hmm. Yeah.
what the fuck?
Oh yeah. We have a lot of uninsured patients. Probably 60+% of our patients don't have health insurance. And so we're constantly navigating ways to get them cheaper things. So like an IUD in the in the state of in the US, it'll cost you around $750 to cash pay for an IUD. I can order you one from Canada for $215. Same box, same thing. Now, the directions are in Turkish. but good news, I don't need the directions to put it in. I know how. So we're good. But it's insane the cost we pay for these things. Um, yeah, it's mind-blowing.
It is mind blowing. And so you talk about being an advocate. It's a lot of what we do in our side of the business as a holistic health practitioner and trauma healer. It's all about advocating for the client. If our client has to go to the doctor, then we're giving them the information that they need to ask the right questions
Hmm.
because you're not going to get that. And you know this. You go over there, you go get a hormone panel done. It's a partial panel. They're not looking at everything. They're not looking through all the other factors. They never even asked you how your lifestyle is. They never even asked you where your stress levels are or anything else. And it's like, here's an antidepressant. We think you need this.
Right. Yeah. Well, and my favorite's when they order a hormone panel and especially on a female who's still cycling, your hormones do this like in however long your cycle is. Average is 28 days. There's not many people that are average, right? Um, but if you don't know where you are in your cycle, those hormones mean nothing.
Agreed.
Right. Now, if you're not cycling, it doesn't matter, right? Like if you don't have periods anymore, then that's fine. As long as it's not caused by some sort of drug, right? Like if you're on birth control or something that's preventing you from having a period. I'll also tell you, if you're on birth control, you might as well not even get your labs checked. Like there is no reason to check your hormones because they're off because you're taking synthetic hormones.
Mm-hmm.
Um, but also if you don't know what day it is in your cycle, and also so many providers, I hear this all the time. Like patients will come in, they'll see somebody, they're like, I just don't feel right anymore, right? Because
Mm-hmm.
let's be honest, perimenopause starts in your mid to upper 30s typically, right? Where things just start changing. Like you got some brain fog, you can't focus as much, you don't have energy, your hair's falling out. There's so many things, right?
Mm-hmm.
Um, and for so long, we've just told women, well, that's part of being a woman, and that's bullshit.
Agreed.
Um, and so, unfortunately, in the world of healthcare, hormones for women have just been ignored for decades. Like, there's just not studies on them. And the most recent studies were developed in like the 90s when they found that estrogen leads to breast cancer. And so people just didn't do it. When I was in school, I finished school in 2008. We had one day on female hormones. And what we learned that day was you do not prescribe female hormones to anyone unless they are literally on the verge of getting divorced because they're that angry. And it's because of the risk of it. But now we have such better options. Oral estrogen, not good for you. If you're taking oral estrogen right now, I highly encourage you to stop. Oral estrogen does have a very high increase in risk of breast cancer.
Mm-hmm.
Patches, creams, pellets do not, right? So you just have to get the things in the right form to decrease your risk. Now, that's not to say there is not a risk taking a hormone. So just so you know, none of what I'm saying right now is medical advice. I am not your healthcare provider. Do not sue me. You cannot sue me for what I'm saying to you right now. But you really have to be an advocate for yourself when it comes to hormones. You need to make sure you have a provider who knows what day you're checking them and knows what to do with it. I will tell you, lab values should have maybe a 20% influence in your plan of care. It should really be your symptoms, your lifestyle,
Mm-hmm.
and how you're feeling. That
Yes.
should really dictate what's going on. Labs are a great thing to have, right? But
Mm-hmm.
they should not dictate your care. If you have all the symptoms of low estrogen, right? Vaginal dryness, brain fog, irritability, abdominal weight gain, and hot flashes, I'm going to tell you, I don't care what the labs say, you have an estrogen deficiency. So if those labs come back that say you're normal, right? Are they really? Not convinced. And so we have to like be advocates for ourselves, right? Like when we go in and do these things. I just had this situation with my mother recently. She called me and was like, they did a liver ultrasound on me and they're saying fill in the blank. And I was like, well, why did they do the liver ultrasound in the first place? Well, because my chart back in 1997 said I had fatty liver. Okay, well, you were 80 pounds heavier then. Why are like, are you having abdominal pain? Are your liver enzymes off? Is anything wrong with you? She's like, no, they just told me I needed it. You have to question these things.
Right.
And so they come back and tell her that her bile duct is too big. And I was like, so what are they going to do? Cut it out? Like, I, yeah, you really have to be an advocate for yourself. You have to go in armed with information. Now, I'm going to advise you though, be respectfully armed, right? ChatGPT did not go to school to learn healthcare for 9 years and has not been doing this for 17 years. I deserve that respect level, right? So come in with your ideas, but don't be a demanding jerk. That's not going to get you anywhere with us, right?
Yeah.
Come in with, hey, these are the symptoms I'm having. I'm concerned about A, B, and C. I did a little research and I think that maybe this is what I need done. And then have a discussion, right? Like allow your provider's education and background and experience to have some say in this, but also don't let them just steamroll you. And so there's this like fine line. And you also have to find a provider that doesn't suck, right? There's some that just aren't going to listen. Don't go to them. Walk out. You do have a choice. Um, and so you really just, I encourage every woman, especially like, do not just accept that this is your normal. You don't need to do that.
So I'm curious with that statement right there, what are some questions they could advocate for themselves? How can we coach somebody even through here how to ask some simple questions to advocate or start?
Yeah, I think go in with something written down, right? Like with very clear questions, very clear symptoms that you are experiencing. Because I think oftentimes when we get in the room, it's like, oh, wait, but I forgot about this. I forgot about this. So, really, like diving into what you're struggling with, what you think the possible fixes for this are, and especially the fixes that you are willing or are not willing to do,
Mm.
right? If you are like, absolutely not, I'm not going on hormone replacement, that is okay. So you need to ask, what are the alternatives, right? And so, really, I think one of the biggest things you can do is have a written, like we do this with like birth plans, right? You go
Yeah.
in with this plan of like, okay, this is what I want, this is what I don't want. These are the people that can be involved. Because when you get into that actual birth part, it's awful and you're like dying and you can't think correctly. The same thing happens when you get into a doctor's office, right? They're 45 minutes late, so you're pissed off anyway. They've asked you the same question 12 times. So you really need to go in with a clear plan of what your concerns are, what your ideas are, what your absolute no's are, and what your yeses are, and the way that you're willing to go. And really having that conversation and trying to lead the conversation. Unfortunately, a lot of healthcare providers are limited with time. And so they oftentimes will cut you off. And you need to make sure that you are heard. And if you're not being heard, you need to find someone else to see you.
But Monica, they're not in my network.
Yeah. So this is a problem, right? And we see this a lot. We're seeing this more and more where people are leaving that network to find somebody who actually cares. Because guess what? You can see 14 people in your network because you're not paying for it, but you're losing your health. And if you don't have your health, then you've got nothing, right? It doesn't matter how much money you have. If you don't have your health, you have nothing. And so sometimes you're going to have to go out of that network. And we see this all the time. People call my office, they're like, do you take my insurance? I'm like, nope, I don't. And then we're like, okay, thanks. And they hang up the phone. And then they end up calling us back 3 months later. Like, I should have just started with you in the first place. Right. If your new patient appointment is less than 30 minutes long, it's not going to be what you want it to be because they're going to spend so much time on your history that they aren't even going to get to what you need to actually talk about. So,
Yeah.
yeah, there's a time and a place for your network. But
Okay.
also, I really question this network thing, right? So if you went to buy a new car, right? You walk into the Lexus dealership and you're like, I want that shiny new 2025 silver Lexus SUV right there. And they said, yeah, that's cool, but you can't have that one. We're going to give you the beat up Hyundai in the back that only has three tires. You would absolutely walk out and be like, screw that. I don't know. I want the Lexus. So why do we settle for that in the
Mm.
world of healthcare? In the one thing that is the most valuable to you, and that is your body. Why do we think it's okay for someone else to tell us who we should see?
Yeah.
We don't let somebody dictate what coffee shop I go to. I go to that coffee shop because they have better coffee than that one. If somebody was like, "Oh, sorry, you can only go to the shitty coffee shop," I would never let that happen, especially as Americans. Like we're all about our choices, yet in the healthcare system, we're willing to be like, "Yeah, I'll go to whichever one you tell me to, even though they might be the worst one on the planet." This is where HMO plans, if you have an HMO, run the other way. They are the absolute most restrictive, worst plans ever out there. I get it. They might be a little bit cheaper, but you're at their mercy. They're going to
Hmm.
find the providers that will accept the least amount of reimbursement, and that's who you're going to see. So yeah,
And then
they
also, if you're in the same building, I remember this being a thing where I would request my doctor because I do some research beforehand on which doctor I was
as
going to,
you should.
because, right. But not everybody does that. We
Hmm.
should. But I was like very adamant about which doctor I was going to go into. Well, we would like to send you to somebody else in our clinic, but we can't because you've already seen this doctor.
Hmm.
But we also have confidentiality. So, and there's a HIPAA thing. Are we sharing HIPAA? Is that what we're doing? Because I'm pretty sure you can't say that I can't go to this doctor, even though it's in the same space. They don't share information back and forth. Well, it's under our facility. I want this doctor. Sorry.
So I will tell you, a lot of that is because when you go in as a new patient to a new office, as in you have not been there in the last 3 years, they can bill you for a new patient visit, which is coded significantly higher in terms of reimbursement than a follow-up. So if you are already an established patient there, that physician that saw you the first time got to bill for that new patient appointment, which means his RVUs went up. So RVUs are how you like determine the productivity of a provider. So if you're calling a place that is under the same umbrella and you go see a new provider who needs that like 60-30 minute appointment, they can't bill for it because they've already billed for it once. And therefore, that reimbursement is significantly less. And so the company itself is going to lose money if they let you have a new patient appointment when they can't bill as a new patient appointment. Hmm. Yeah.
Man,
Have
we're just what?
right.
Ugh.
Have you ever wondered why you can't get your physical and your PAP done in the same day? Well, let me tell you why. If you code for a physical and a PAP in the same day, you get paid at 50% for the second code. So if I get paid $150 for a PAP smear, but I do it the same day as your physical, I'm only getting $75. But if I make you come back the next day and do it, see me again, then I get $150. It's the dumbest thing. It's ridiculous. It's like, oh, well, if you do two things, then you don't get paid as much. This is oftentimes why they won't like cut off a mole and treat a sinus infection is because you can't get paid for both.
Which is why whenever you fill out the papers, you have to stick to one symptom that you're facing right now.
Yes. If you have so the way that coding, billing and coding is done,
Yeah.
it's very rare to get to a level 5, but you can get to a level 4 with just 2 complaints. And so if you have 4 complaints, I can bring you in for 2 visits and get paid twice. Where if I let you talk about all 4, it's not going to be enough to get me to the next level. And so it behooves me as a business to make you come in twice. So this is oftentimes why you're limited to just 2 things. It's also why you can't talk about an acute thing at your annual physical.
And that makes sense because I know it's coded. That makes sense because I understood that from the thing. You're going in for this. You can't talk about other things. I remember that being the thing. And you'd probably reach through this computer because I ain't been back in like 5 years to get any kind of pap
Yeah.
smear thing done. Don't care.
Well, it's because it's hard. You don't know
Yeah.
how much it's going to cost you. And they might give you bad news. And who wants that? Especially if it's somebody you don't even know. And turns out pap smears are not that comfortable. So, yeah, you
No.
are much like many people in this country.
Yeah. I don't go to the doctor for much of anything. Now, I will go to like a functional medicine physician or something. I have my hormone clinic locally that I'm like, hey, can you just do a full lab panel? Let me look at it. And it's interesting because the last time I went and got my labs done, like my estrogen was high, testosterone was in single digits, go figure. And my EBV levels were like way back up. And I'm like, I even told them, do not run this through my insurance.
Yeah. Well, they won't cover it, and then you're going to
They,
be out
yeah.
God knows
I
how
was
much
like, I'll
money.
pay out of pocket for that one. As
Hmm.
I'm saying this out loud.
Yeah. Yeah, and I mean that's one of the biggest reasons patients come to us is that they know the cost of their care before they get it done, right? I can get you a cash pay MRI for $350. That same MRI, if I run it through my insurance company, I have a high deductible plan, is going to cost me $1,500 to $1,800. So why would I run that through my insurance? Like I'm still paying out of pocket. Now, if I'm going to meet my deductible, then it makes sense to pay that much. But the goal is never to meet your deductible. And
Right.
so, it's a whole thing. Instead, I'll just pay the insurance company, $350 a month for my annual physical. But that's another story. I'll tell you, I could talk about this for decades. Yeah.
God, and we could be here for hours talking about
Hmm.
this. So I got another question because I know you're not the only direct primary care clinic that is out there. More than likely you're the best because you're
I
advocating
mean, clearly the best,
clearly,
but
and I'm down for
yes, there
it.
are others out there. So my clinic is in Central Texas, so in the Austin area. So if you're in the Austin area, you need a provider that doesn't suck. Look up Impact Family Wellness. For those of you that aren't, you can Google DPC, Direct Primary Care Mapper. It's under Frontier something, but there's a map that will show you all the clinics like mine across the entire country. There's around 2,700 of them currently. As we mentioned, probably not as good as mine. And also, I encourage you to shop around. Like, if you
Mm,
have more than one in your location, do a meet and greet. Most of them will offer a free meet and greet where you can come in, sit with the provider for 15, 20 minutes and like actually talk to them and see if your personality mixes. This is the beauty of direct primary care is that you get the choice of who you see. People don't walk in my front door of my office because Blue Cross Blue Shield told them they had to. They come in because someone told them about us or they saw us on social media or something. And then they get to choose who they see. And so I encourage you, find one that fits you, what you want, right? If you're more of a Western medicine person, then find a Western medicine person. If you're more holistic, more functional, then find the people that fit that mold for you. You shouldn't have to mold yourself to the provider. The provider should fit you.
yeah, that's so true. We have a lady who is in our local area. I'm not sure if she considers herself as direct primary care, but she does very similar things like that. She can She can do prescriptions. She takes more of a holistic route for
Yeah.
things because that's most of my people's jam, and that's where I send them to. And then we
Hmm.
have another lady who she's all about supplements and stuff too. So
Yeah. And
very
thankfully, I
different.
think our population is getting to the point where they are looking more holistic.
Mhm.
Because if you look at our population and how much Western medicine we've pushed on them, we just continue to get sicker and sicker and sicker and sicker. And so finally, I think people are realizing, like, oh, it's not a pill I need, it's a lifestyle change I need. Maybe I should go to bed and turn my damn phone off and maybe eat something that wasn't ultra processed and move your body for, 5 minutes a day.
Yeah.
Minor things.
Yeah. So do y'all
Mhm.
do nutrition in your clinic too when somebody comes in there?
Yeah, I mean, we'll talk about it. We are not certified nutritionists. We're not registered dietitians. We do have people we can refer you to. But yeah, we talk about these things all the time. But let's be honest, nutrition is pretty simple. The less ingredients on the package, the better off you are.
Yeah.
And maybe even something that doesn't come in a package might even be better.
But we have some of those busy moms, Monica, and we have to help them out. So we look
You
at
know,
more.
it's true. And I will tell you, I did a no ultra processed food October. I did not eat a single thing that had an ingredient in it that wasn't in my house, right? Like has those weird chemically names, whatever, right? I still ate flour. Now, granted, I made all the bread myself because everything you buy at a store is going to have these in it.
Mm-hmm.
And I not only felt significantly better, I lost 10 pounds and ate whatever I wanted, but I had to make it at home. But then and I continued it through November, but then I got busy and I was like, oh, what are we going to have for dinner? And so I made a boxed pasta, right? Like protein, whatever pasta. But of course, it has these weird ingredients in it because it can sit on a shelf for decades. I felt so bad after I ate that. Like my body was revolting against me. And
Yeah.
so, yes, it has taken time, right? Like I've been making my own chicken broth because I'm flabbergasted at what's in chicken broth, right?
Right?
Like mind blown at the number of gums and extra additives and preservatives and things to make things taste better. Like
Yep.
it's insane to me. But I also don't crave those things anymore. I have
Yep.
not even thought about eating one piece of Halloween candy, and it is right out there. Like we still have this huge bucket, and I don't even want it anymore. It's like no, not here for it. So yes, it does take time and it takes energy, and we are all busy. But guess what? We also have to make decisions.
Yes, we do. Yes, we do. And this is why we do what we do because we give them, it's like most of the clients that come work with us, you got a 2 to 3 weeks, suck it up, buttercup. This is what we're going to eat. Now, it's not flavorless and whatever. And like
Oh
we
no.
keep it yummy. And if there are any, like we do healthy swaps for things because we've got kids involved and everything else with most of our clients. But I mean, it's like you said, you lost 10 pounds in the month of October. That's
Hmm.
like how our clients lose weight. I've had clients
Hmm.
who have lost 20 to 22 pounds in 6 weeks. And it's not just nutrition, okay? We're not being strict with it, but it's also the stress. Like we talked about at the beginning, the
Mm.
stress, the traumas, the whatever your body's holding on to.
Yeah,
So,
absolutely. Self-care turns out it's not it's not being selfish. It's
no,
just taking care of you. I I'm glad that don't let this out by tomorrow, but like tomorrow afternoon, I blocked my schedule. It just says that I'm going to a meeting. I'm actually going to the movies all by myself because I want to see a movie. I'm turning off my phone because I'm in a meeting, and I'm just going to go on a random Wednesday afternoon because I can and I'm gonna. And
I
that's
dig it.
what I need to do to take care of me. So, yeah,
Yeah, we should have more mental health days.
100%.
And it
Turns out
should,
rest is okay. And I've had to learn this the hard way. Like
yeah.
I'm the person like, okay, let's go, let's go. We got to do something. But it's okay just to sit and let it be quiet and not
Mm,
turn the TV on and not doom scroll and not do all the things. Hmm.
yeah. There's certain days I'm like, kids go outside, mommy's gonna lay on the couch and take a nap.
Yeah. And that's okay.
Come
You'll be
back
just fine.
later.
You'll be just fine for sure. Hmm.
Awesome. Well, before you go, tell us where we can find you on social media, get all your amazing tips and all the wonderful things.
Yeah, so impactfamilywellness.com on all the social platforms. We are Impact Family Wellness. So there's a ton of video content on Facebook, Instagram, and TikTok. We also have a YouTube channel. So there's lots of podcasts that I've done as well, especially on hormones for women. I have a very not normal name. So if you just Google Monica McKitterick, you're gonna find me all over the place, and it's me because there's only one of me. So yeah, there's tons of info all over the place.
I think we're going to bring you back again and do one on hormones. I had a lot of questions come up because that's most of our ladies. They're struggling through
Yeah,
menopause.
absolutely.
Myself.
Yeah,
And
I
some of
will
these crazy
absolutely come back and talk about it.
and like GSM issues that are now coming up.
Hmm.
So
Yeah, all the
yeah,
things, all the things.
we'll circle back on this for sure, guys.
Anytime,
All
anytime.
right, fam. That is our wrap up for today. Thank you, Monica, so much for your time. And thank you for all your information and the
Yeah,
wows. We got the wow
anytime.
factors today.
I try to bring the sass, my friend.
Yes, and we appreciate it and the humor. So, all
Right.
right, guys, check out that video. We've got all the links in the description. So, check all those out, and we'll catch you on the flip side.